My name is Jasame Arquijano. For this video, we're going to discuss or explain to you what is COVID-19, booster, vaccine, its advantages or disadvantages, and many more. I believe all of us are aware that we are now almost 2 years facing the one of the world's biggest challenge that not only threatened the human lives but also had an immense impact on the economy, safety, and religious practices. Also, it is worth noting that the situation has worsened. Why? It is because of the lack of proper guidelines for fighting the sudden, unexpected outbreak of the virus. Yes, it is a virus and not a bacteria. And this virus is what we called the COVID-19. What is COVID-19? Well, it is a new respiratory illness caused by the SARS-CoV-2 virus. It is first discovered in Wuhan, China. But the original source of viral transmission to humans remain unclear, as does whether the virus became pathogenic before or after the spillover event. Also, it has reached more than 150 nations and has caused World Health Organization to call the disease a worldwide pandemic. Why? Because by the time of second week of April 2020, these COVID-19 cases exceeded 18 million plus, although more than 1 million plus deaths were recorded worldwide. Here are the symptoms: fever, cough, difficulty breathing, muscle pain, tiredness. How is it transmitted? It can be through close contact with an infected person, because the virus can spread from an infected person's mouth or nose in small liquid particles when they cough, sneeze, speak, sing, or breathe. Also, by touching contaminated objects or surfaces and then touching your mouth, nose, or eyes. Next is how we can prevent it. First, be well informed about the virus. Also, avoid contact with sick people. Wash your hands with soap and water or alcohol. Keep 6 feet distance from others. Wear face mask. And get vaccinated. So what is vaccine? Well, since the start of the COVID-19 outbreak, World Health Organization has worked with countries and areas in the Western Pacific region on public health measures to slow or to stop the spread of the virus. Safe and effective vaccines are an important tool in combination with other measures to protect people against COVID-19, save lives, and reduce wide-scale social disruption. Countries and areas in the Western Pacific region have already completed regulatory approval and started introducing one or more COVID-19 vaccines, like Pfizer, Moderna, Johnson, AstraZeneca, Sinovac, and many more. A reminder from Joseph Borrell: COVID-19 will reshape our world. We don't yet know when the crisis will end, but we can be sure that by the time it does, our world will look very different.
Are you fully vaccinated? If not, then I will discuss some of the advantages of getting vaccinated as early as now. Vaccines prevent diseases that can be dangerous or even deadly. To understand how vaccines work, it helps to first look at how the body fights illness. Sometimes after getting a vaccine, the imitation infection can cause minor symptoms, such as fever. Minor symptoms are normal and should be expected as the body builds immunity. Before a vaccine becomes available, it is run through clinical tests. It is first administered to animals to test for adverse effects. If it produces none, it then goes through about 3 rounds of clinical human trials. If no harmful effects are seen and the drug seems effective, then it is released for human use. Did you know that when you get vaccinated, you're not only protecting yourself, but you are also protecting your family and your community from contagious and dangerous diseases? Recent data suggests that COVID-19 vaccines become less effective at preventing infection or severe illness over time, especially for people who ages 65 years and older. This is why booster shots are recommended for people who ages 12 years and older who have completed their primary vaccination series. However, even as the vaccine's ability to prevent infection decreases with time, the COVID-19 vaccination continues to reduce the risk. A booster dose of the COVID-19 vaccine significantly reduces a person's odds of hospitalization from the Omicron variant. New research released by the Centers of Disease Control and Prevention find of hospitalization and death when people become infected with COVID-19, according to NBC News. COVID-19 vaccination helps protect you by creating an antibody response without you having to experience sickness. Getting vaccinated yourself may also protect people around you, particularly people at increased risk for severe illness from COVID-19. Getting sick with COVID-19 can cause severe illness or death, and we can reliably predict who will have mild or severe illness. If you get sick, you can spread COVID-19 to others. You can also continue to have long-term health issues after COVID-19 infection. This is Abigail G. Casilian reminding you all that prevention is better than cure.
COVID-19 vaccines are safe, and getting vaccinated will help to protect you against developing severe COVID-19 disease and dying from COVID-19. But no vaccine offers 100% of protection. You may experience some mild side effects after getting vaccinated, which are signs that your body is building protection. So this afternoon, I will discuss about the disadvantage and its reaction to our body. Like any vaccine, COVID-19 vaccines can cause side effects, most of which are mild or moderate, and go away within a few days on their own. More serious or long-lasting side effects are possible. Reported side effects of COVID-19 vaccine have mostly been mild to moderate and have lasted no longer than a few days. Typical side effects include pain at the injection site, fever, fatigue, headache, muscle pain, and diarrhea. The chances of any of these side effects occurring after vaccination differ according to the specific vaccine.
Good morning everyone, I'm Clara Castillo, today's reporter about relevant news on COVID-19. The Omicron variant. The Omicron variant, as Omicron cases spread around the world, scientists are trying to determine the variant's origin, but some experts disagree on where and how the puzzling variant evolved. Today, I'm going to discuss all important things to know about Omicron variant. So where did Omicron variant originated? Is it true that Omicron originated in South Africa? Omicron was first identified by South African scientists who reported the variant to the World Health Organization, or WHO. However, it is not certain that the variant started in that country. For example, the National Institute for Public Health and the Environment in the Netherlands said retests of samples taken on November 19 and 23 found that Omicron was already in the Netherlands before South Africa reported it to WHO. Nigeria was the first country to detect the Omicron variant in West Africa since it was first reported in Southern Africa. As of November 30, the European Center for Disease Prevention and Control confirmed 33 Omicron cases across 8 countries in Europe, including the Netherlands, Austria, Belgium, Germany, Czechia, Denmark, Italy, and Portugal. It has also been found in other areas of the world, from Hong Kong to Israel. according to NPR news reports. As a result, it is unclear where the variant actually emerged, said by stats reports. And South Africa and Botswana may have spotted it early because only of the strength of those area genetic sequencing networks. Bedford has three possible originations. First, an animal source, according to Bedford. One possibility is the mid-2020 strain infected an unknown animal population, mutated as it is spread among them and recently began infecting humans again. Second, a cryptic spread is an unmonitored region. Another possible scenario is that the mid-2020 strain began circulating somewhere that has minimal monitoring and would allow the virus to evolve undetected, perhaps somewhere in southern Africa. Third, the incubation in an immunocompromised person. The virus may also have incubated and evolved inside of a single person, like evading direction by health officials. More specifically, scientists have theorized that the virus could have mutated inside of the individual with a suppressed immune system. For example, an individual with an untreated HIV infection. Is Omicron really less severe than Delta? Multiple lines of evidence from various parts of the world suggest that the Omicron variant causes a less severe form of COVID-19. Omicron is more transmissible and better at evading existing antibodies. Omicron is between 2 and 4 times more contagious than Delta. Patients are showing up less often with pneumonia-like symptoms and hyperactive immune systems. As seen in previous waves, Omicron appears to be less severe than Delta in all age groups, even in adults older than 65, according to the Case Western study. According to Inquirer News, Philippines reports first 2 cases of Omicron variant. One of the cases is a returning overseas Filipino who arrived from Japan on December 1. The DOH said the individual is currently asymptomatic but had colds and cough upon arrival. The other case is a Nigerian national who arrived from Nigeria on November 30. He is also asymptomatic. Both are isolated in a facility managed by the Bureau of Quarantine. I know you heard some news about Poblacion Girl. The Philippine National Police is filing cases against 9 people, including Gwen Chua, the returning overseas Filipino who breached quarantine and whose name has gone viral. Witnesses and CCTV footage placed her at a bar in Poblacion, Makati City, partying with friends on the night on December 23, 2021. CIDG investigators confirmed that she was leaving the quarantine facility and disregarded the quarantine procedure, violated the mandatory reporting of notifiable disease and health events of Public Concern Act, particularly a section in its implementing rules and regulations defining non-cooperation. Another very alarming news, PGH now in crisis mode, as 300 health workers contract COVID-19 according to Daily Inquirer. The Philippine General Hospital, or PGH, is now operating in a crisis mode, as nearly 40% of its COVID-19 health workers are either infected with the SARS-CoV-2 or now in quarantine after being exposed to the virus. According to Dr. Jolas de Rosario, roughly 40% of the workforce are infected or quarantined because of COVID. If conventional quarantine protocol is used in the hospital, will run out of the doctors, nurses, and support staff to take care of patients. They are operating in a crisis mode. So those are some of relevant news about COVID-19. Again, I'm Sholo Grace Castillo. Thanks for watching.
Hi, my name is Kimberly Emmanuel. Relevant news report about Delta variant. Delta variant is a variant of SARS-CoV-2, the virus to process COVID-19. It was the first detected in India lately, 2020, and was named on May 31, 2021. The Delta variant had spread to over 179 countries. By November 2021, the World Health Organization declared in June 2021 the Delta variant had become the dominant strain globally. It has mutation its gene encoding the SARS-CoV-2, the spike and protein, which are known to affect transmissibility of virus as well as weather. it can be neutralized by the antibodies for previously circulating variant of the COVID-19 virus. The said variant may be causes more severe cases than other variant. Immunity from the previous recovery or COVID-19 vaccine are effective in preventing severe disease or hospitalities action from the infection with the variant. Research in the UK, utilizing data gathered in May 2021, estimated the realistic possibility of being 50% more transmissible than previous strain. The Philippines, in the middle of July 2021, reported its first local case of the more infection Delta coronavirus variant and placed some area outside the capital under strict lockdowns. 16 new Delta variant cases were detected in the country, including 11 classified as a local cases. Health Undersecretary Maria Rosario Vergir said that verifying the fast spreading the variant and fluing as residents and infection across in Southeast Asia amid largest and vaccine rollout. The World Health Organization declared on Tuesday, August 31, 2021, that highly transmissible Delta variant was now the dominant COVID-19 variant in the Philippines. However, even with the highly transmissible and dominant Delta variant, the Philippines has controlled the rise in number of the coronavirus case with the better healthcare system in a place, a health official said by lately October 2021. The Brigade said a total of 746 samples were collecting in the March, April, September, and up to October 2022-2021. Of the sample collected and sequenced, about 380 or 50.94% were Delta variant cases, 104 or 13.94% were Alpha variant cases, and 166 or 22.25% were Beta variant cases. The variant is thought to be partly responsible for India's daily second wave of the pandemic beginning in February 2021. It later contributed to a third wave in Fiji, the United Kingdom, and South Africa, and the WHO warned in July 2021 that clouds have a similar effect elsewhere in Europe and Africa. By lately July, it had also driven increases in daily infection in parts of Asia, the United States of Australia, and New Zealand, yet another COVID variant.
There have been 3,417,216 infections and 53,473 coronavirus-related deaths reported in the Philippines since the pandemic began, 273,580 active cases, and 3,090,164 recoveries. Manila, Philippines. Over a year since the first confirmed case on January 30, 2020, the total number of cases in the Philippines already breached 3.6 million on January 12, 2022. The chart shows the number of confirmed cases reported by the Department of Health per day. See also the country's 7-day running average for daily new cases.
After a surge of cases that peaked at 6,958 infections on August 10, 2020, the country's 7-day average for new cases went below the 3,000 level in late September, then dipped below 2,000 by late October after a brief spike. In mid-January 2021, after the holiday season and the emergence of a new COVID-19 variant, the 7-day average neared the 2,000 mark again. In the weeks that followed, it held steady above 1,500. But in late February, the uptick in new cases continued as the average crossed 2,000 once more.
On March 13, the country logged 5,000 new cases again. The last time that happened was in the late August 2020. New one-day records were set in the following months, the highest of which at that time was 26,303 cases on September 11, 2021. The 7-day average of new cases briefly dipped below the 5,000 level around mid-July, then went up again due to the presence of more infectious Delta variant. After a fresh peak around mid-September, the average went below 1,000 in late November, but has been quickly climbing again since late December, after cases of Omicron variant were confirmed in the country. The current highest one-day tally of new cases stand at 33,169 reported on January 10, 2022.
Hi, I'm Emilita Castro. We all know that the virus started in Wuhan, China on December 2019. So here's the line graph of total cases worldwide, includes deaths and recovered or discharged patients. On January 22, 2020, the total cases of COVID-19 worldwide are 987. When the virus is spread in different countries, the number of total cases are increased. So as of March 31, 2020, the total cases are 964,455. Year 2021, 26th day of January, the total cases worldwide have reached 100,845,381. And by the month of August, it reached more than 200 million total cases around the world. Until the New Year's came, as of January 13, 2022, the total cases worldwide are more than 300 million COVID patients, includes the deaths and recovered patients. As of January 22, 2022, the countries with the highest share of COVID-19 cases worldwide are US, India, and Brazil. The United States with 20.54% and 71,725,786 cases. Next is India with 11.23% and 39,212,000 cases. And Brazil with 6.86% and 23,960,207 cases. And that will be all. Stay safe and thank you.
Hello everyone, this is Christine Villan. For all the ideas and problems stated by my other groupmates regarding the COVID-19 pandemic, it is still our decision whether to believe in it or not. However, keeping ourselves safe and taking care for those people we love can truly help us to prevent having disease. Be responsible and attract other people to become a law-abiding citizen of the Philippines so we can all survive this pandemic we are facing right now. We Filipinos are known for being resilient. When we are facing such occurrences, we do not let those happenings take turns to us. So despite these many problems we encountered during the pandemic, losing their job, businesses that turns down, establishments that forced to shut down, and to our families and relatives who got sick, we still find our ways to have solutions for all of it and strive harder for our daily lives. Yes, there are times that our faith may be tested, but continuous praying and talking to Him will enlighten and help us to have our way and to survive. Remember that being healthy is a victory.
Thank you, Christine, for the additional of the information about conclusion to COVID-19. The coronavirus disease continues to spread across the world, following a trajectory that is difficult to predict. The health, humanitarian, and socio-economic policies adopted by countries will determine the speed and strength of the recovery. This crisis will eventually pass by with the help of the government and the people of the country. Follow the health protocol and social distancing. We're talking about our health, so it's better to prevent than cure. And I, Christian Zacarias, your speaker, thank you.